Hello, my name is Anthony, and for my disease, I've chosen to talk about diabetes. What is diabetes? Diabetes is when the insulin in your pancreas, there isn't enough of it, or it's not working properly. Symptoms of diabetes is frequent urination. This is because from all the excess glucose that is not being used, your kidneys have to filter it and remove it, leading to increased urination. Excessive thirst. Increased urination causes dehydration, promoting and heightened thirst. Next one is hunger. Insufficient insulin or ineffective insulin use prevents glucose from entering your cells for energy and leads to low energy levels. Another symptom is blurred vision. High blood sugar can cause swelling in your eyelids, resulting in blurred vision. Another one is slow healing wounds. High blood pressure can impair the circulations and the immune response, slowing down wound healing. What are the causes of diabetes? There are 4 causes of diabetes. Type 1 diabetes, which is an autoimmune reaction which destroys insulin-producing beta cells in the pancreas. Type 2 diabetes is when the body develops insulin resistance where cells don't respond well to insulin. The third cause is gestational diabetes. This is when pregnancy hormones can create insulin resistance, leading to high blood sugar. And the last one is genetic factors. A family history diabetes can elevate the risk of developing diabetes. Affected glands and hormones. The gland that is being affected is the pancreas, which plays a crucial role in regulating blood sugar by producing insulin. The hormone that's being affected is insulin, which allows glucose to enter the cells for energy. In diabetes, though, insulin production is inefficient for type 1, or the body doesn't respond well to it. Type 2. Diagnosis. There are 3 ways you can get diagnosed for diabetes. Fasting blood sugar test, which measures glucose after 8 hours of fasting. A level higher than 126 milligrams per deciliter indicates diabetes. The second way you can get diagnosed for diabetes is the oral glucose tolerance test. After fasting, the patient drinks a sugary solution, and the blood sugar are tested 2 hours later. A reading of 200 milligrams per deciliter indicates diabetes. And the last one is hemoglobin A1C test, which measures the average blood sugar over the past 2 to 3 months. An A1C test of 6.5% or higher indicates diabetes. Who is the most susceptible? For type 1 diabetes, it's commonly diagnosed in children or in young adults. For type 2 diabetes, it's commonly diagnosed for adults over the age of 45, but younger generations are getting type 2 diabetes from health style choices and obesity. And the last one is gestational diabetes. Pregnant women, especially those who are overweight or have a family history of diabetes, can get it when they're pregnant. For treatment for type 1 diabetes, insulin therapy via injections or an insulin pump is required since the body no longer produces insulin. You have to monitor your blood sugar multiple times a day, and diet and exercise may help the glucose levels, but insulin is always necessary. For type 2 diabetes, lifestyle choices including healthy diet, regular exercise, and weight loss can improve insulin sensitivity. Oral medications can also help, such as metformin, to lower blood sugar levels. And if those 2 don't work, you may have to get insulin therapy if the blood sugar cannot be controlled. Last one is gestational diabetes. The first approach is diet and exercise. You have to monitor your blood sugars multiple times a day, and if those 2 do not work, you may need insulin therapy or injection. Pros and cons of treatment options. Insulin, essential for type 1 diabetes, sometimes for type 2, can effectively lower blood sugar, but requires careful monitoring to prevent hypoglycemia, which is low blood sugar. The second one is oral medication. It helps type 2 diabetes manage blood sugar, but sometimes has side effects such as nausea or weight gain. Last one is lifestyle choices. Can improve health and reduce diabetes, but require long commitment, and discipline. Public health interventions. Some public health interventions is diabetes prevention programs, which encourage at-risk individuals to adopt a healthier lifestyle. Second one is public health awareness campaigns to educate people on the importance of diets, exercise, and regular checkups. And third one is access to insulin and medication. Efforts to lower insulin prices and improve healthcare accessibility make sure that anyone can have access to it. And the fourth one is school and workplace health programs, which promotes wellness initiatives, healthy food options, and physical activity. History and notable figures. Discovery of insulin. Diabetes has been recognized since the ancient times, but insulin was discovered in 1921 by Frederick Banting and Charles Best in Canada. They successfully treated diabetic dogs with insulin extracted from the pancreas, leading to a life-saving treatment. Notable figures with diabetes is Tom Hanks, which is an actor who has type 2 diabetes, and Halle Berry, which has type 1 diabetes and is an actress. They both advocate and spread public awareness. Current research. Artificial pancreas technologies, devices that automate insulin delivery based on real-time glucose monitoring. So the second one is stem cell therapy. Research into regenerating insulin-producing cells in the pancreas. Third one is new medication, investigating drugs that can improve blood sugar control with fewer side effects. And the last one is identifying gene markers inside of your DNA that increase risk of diabetes, so you can be informed that you have diabetes before it's too late. Thank you for listening to my presentation. Have a good day. Adios.